Seems like each week we are learning something new about the coronavirus and how it behaves. And as always, to sort through all the details and developments, we are joined once again by our medical expert, Dr. Arnold Baskies, joining us live. He is past chairman of the National Board of Directors and the American Cancer Society, and as well as the chair of the Global Cancer Control Advisory Council as well. Welcome back, Doc. How are you?
Good morning, Lucy.
So about this race to the vaccine, as they call it, this week Russia announced that they have developed one for the coronavirus and that it works in protecting people from the virus for 2 years. But the medical experts here say, the states say it's not so fast at this point, that they're not convinced that this is safe and effective. What's your take on this, Doc?
Well, not so fast is really the key words here. Let me update you on the vaccine saga. The story changes by the day. The Russians claimed that they have an effective vaccine, which Putin stated has actually been used in his daughter. The Chinese actually vaccinated their soldiers months ago already. The Russians have tested their vaccine in just 76 people. Their vaccine has yet to complete a trial that convincingly shows that it's safe and effective in a large group of people. That approach can jeopardize the confidence that the world would have in a competent vaccine if there are problems with the Russian vaccine. But basically, it's easy to make a vaccine in the lab, but it's a lot different to properly test it and show that it works. So I would treat the Russian news as questionable. So here's the news.
Go ahead, Doc. I was going to say, 76 people, just to give people a very clear perspective on this, that's barely a trial in the U.S., right? Like, that barely meets the burden of proof here, correct?
Right. I'd rather not sling arrows at the Russians, but it's really not what we want.
Sure.
Let's really get to the heart of the subject. There are 4 vaccines right now that are leading the way. There's the British Oxford AstraZeneca vaccine, which we'll call the British vaccine for short. There's the Pfizer vaccine, the Johnson & Johnson vaccine, and the Moderna vaccine. All of those vaccines have been shown to be very safe. AstraZeneca has promised hundreds of millions of doses to the European Union and hundreds of millions of doses to the U.S. I believe that we will have an effective, well-tested, and safe vaccine in 100 days by Thanksgiving. Now, that won't be generally available, but I believe that we will have at least one vaccine that we know about in great detail by the end of November. So stay tuned for that. And by the way, the highest levels of science and government under Dr. Francis Collins at the NIH have been working on distribution of the vaccine that is already in production. There will be multiple vaccines, but I don't think the Russian vaccine is the one that we're going to be talking about.
All right, Doc, what about this? A new study says that a growing number of people in the U.S. and abroad say they will not get the vaccine once it is available. You and I spoke about this last week. How can the medical community calm people's fears and uncertainty about the vaccine? Is that a hopeless situation there?
I think to calm the fears, the best thing to do is to stay off the internet. There are polls that show that 30% of our people have a fear of receiving a vaccine. And I really blame social media and people who have an agenda for this. The way that vaccines get approved in this country is very stringent and very safe. The FDA has an independent advisory committee, largely consisting of academic people, that routinely review vaccine approval applications. Between the NIH and the FDA, I have tremendous confidence that any vaccine which is approved will be safe. But we as a country, if we don't embrace a safe and effective vaccine, we are going to continue in this ridiculous state of fear, lockdowns, civil unrest, masks, and kids not being able to go to school. So one of my favorite expressions comes to mind: we have met the enemy, and the enemy is us. Or as President Roosevelt once said, we have nothing to fear but fear itself. And by the way, any of us can volunteer for one of several clinical trials to test the vaccines that are available by going to coronaviruspreventionnetwork.org. So we as a country need to come together. We need to have great confidence in the medical community as well as the FDA and the NIH, all of whom want a safe and effective vaccine. Stay off the internet. Don't pay much attention to social media, and we will be okay.
It has become politicized, and then this week the Biden campaign said it would like a 3-month mask mandate. And beyond the politics of it all, what does science say about the covering of the face? What do you think about this whole thing? What would it accomplish?
Well, the whole debate regarding masks gets around another issue. You know, my Aunt Linda back in Massachusetts, who resides in a senior citizen facility, has the best solution to slow the virus spread, and that's social distancing and avoid large indoor gatherings. Next best way is to wear a mask. There is an estimate from the University of Washington that thousands of lives could be saved by wearing masks. The virus spreads via respiratory droplets, which are heavier particles, and aerosols, which are smaller particles, and direct contact. We believe that droplets are the main way that the virus is spread. So we have a method to try to help stop the virus by spreading by wearing masks. It's safe, it's simple, and it can be effective if the right kind of mask is appropriately worn at the right times and worn in the right way. Bottom line, at this moment in time, the best way to try to stop or slow the spread of the virus is the same that it has been for the last 400 years with a respiratory illness: social distancing and wear a mask.
Now, many big-name college sports programs nationwide, they are scrapping the plans for their fall seasons. Yet, there are some coaches and some leagues that believe that they can still play and keep the student athletes safe. Is it possible? Is it worth the risk?
So the best way to look at this is to look at what's going on in sports in general. So far, we have some successful sports examples: golf, pro basketball, and pro hockey. Golf has been successful. Social distancing is possible in golf, and it's part of the game. Pro basketball and pro hockey have become bubble-fied with layers of precaution associated with that. College football and college basketball could be successful, but in my opinion, it will be very challenging. Can the athletes and the staff be isolated and tested on a frequent basis? If that can be done, then yes, those sports can be played. This really is the formula that would be the baseline requirement to have successful seasons for contact sports. But there has to be some kind of social distancing that goes on by the athletes from the rest of the community that they live in. And that's why baseball hasn't been successful, because they haven't been able to do that same formula that pro hockey and pro basketball have adjusted to.
It's incredible to see the differences just among every sport. Thanks, Doc. Appreciate it. We'll see you again soon.